patients do not enjoy the rights or the level of engagement that they should, or that they are in some parts of the world, particularly in Europe and certain other parts of the Western world. So national patient organizations are striving for their rights to be heard, for their rights to be acknowledged, for putting forward requests and improvements in policies, in treatment. And therefore, that's one of the most important roles of Thalassaemia International Federation, to strengthen the work, the power, the voice of the patients around the world. How does it do it? Well, either by supporting the infrastructure of the organization, by supporting it, networking of the organization with its competent authorities, by introducing the value of the patient engagement and giving examples of how patient engagement can improve the healthcare systems for the benefit of the government. But, you know, a lot of countries are not seeing this, whereas we are very much involved in how patients can help us understand better and reform policies which are for the benefit and should be for the benefit. And it's the obligation of every government to strive for the benefit of its patients. But on the other side, strive for resource allocation, for savings of resources, and by addressing effectively and appropriately diseases that are based on patient-centeredness and looking at what patient needs are, of course, the better the reforms and the changes are. And therefore, that's how we are working with the patients. Very importantly, we give them guidance, education. When we started back decades ago, and even so, I could say some 10 years ago, the knowledge of the patients on their own disease and its needs were from confined to largely confined, because they left their fate on the hands of the treating physicians. They were considered, and still are in many countries, as, chronic diseases are citizens that, they should be dependent on their treating. That paternalistic view that were present in our countries and still are largely in some ethnic minorities still exist. So we needed to educate, first of all, the patients, because if they were to support changes, they needed to know exactly what that change would support in the context of their care. And unless they knew their disease very well, they could not support or document the changes that are needed to purchase a drug, to pay for a drug, to change a legislation. So that was a very great contribution of TIF to the patients. In the last years, the development of electronic means, of platforms for patients, but also, very importantly, for treating physicians, because we must admit that medical expertise is lacking, and in rural areas largely lacking, in some areas not existing. And if you give the opportunity to a treating physician that comes across thalassemia and can have access to a website and can have access to an electronic platform telling him what it is all about, even if that will give 5% benefit to the patient, for us is a gain. So all these are being developing, and as we see the inequities and as we see the challenges across, we bring about new actions and activities. And the last work of TIF on the Global Thalassemia Review 2021 has been a milestone in the history of TIF, and I must admit, in my history with TIF as well, because it was a compilation of so much information for so many countries, and all it showed in almost more than 80% of our countries was the inequity existing and the great efforts that are needed and the challenges that are still faced by our patients. Therefore, now we are more armored, we are more equipped to actually fight. It would be a very strong advocacy tool. And we need the help of everyone, the help of the industry and the help of the academia to have that synergy we had back in the 1970s when TIF was developing gradually into a global federation by 1986.